Computerized physician order entry refers to the process of provider entering and sending treatment instructions, including medication, laboratory, and radiology orders through a computer application rather than paper, fax, or telephone. 96% of all US hospitals are implemented with CPOE system. When the organization started its hospital survey in 2001, the figure was 2%. However, based on the 2015 hospital survey, CPOE systems failed to send alerts for 39% of potentially harmful drug orders and 13% of potentially fatal orders. Overall, CPOE is improving, but still misses fatal med errors. In order to fix this, hospitals should consider work with their health IT vendors and clinical leaders to improve medication reconciliation and avoid potential errors. Another possible solution is to redevelop or improve the reliability of the alert sets.
Now, as my colleague spoke about earlier, CPOE is great because it eliminates the need for writing anything down on paper. You can do everything electronically. But there are a few issues with the system, one including design. There's been cases where some doctors weren't able to be alerted or they missed the alert about certain needs of the patient, or maybe the patient isn't supposed to take some sort of drug or substance. And as my colleague mentioned, there are cases where doctors have given the incorrect medication to patients, and that has caused an issue. So if this issue isn't solved with the CPOE system, especially in terms of design, we can expect a lot more fatalities with our patients.
And I'm going to talk about the first reading in our Health Informatics class, and it's called Application of EHR in Healthcare, written by Juan Yina. So in this article, Yina explains that EHR, or Electronic Health Record, is a collection of electronic health information about individual patients, and it is capable of being shared across different healthcare settings, being embedded in network-connected systems. So why is this important? Well, there are a lot of problems in our current system, such as high expenditures, inconsistent quality, and gaps in care and access. There's also a need to combine patient information, such as demographics, medical history, allergies, immunization status, and billing information. So with EHR, we can reduce costs, increase efficiency, and promote evidence-based medicine. So other advantages with EHR can be seen through current problems, such as a patient's information is usually disjointed. So in order to see different aspects of a patient's care, a provider would have to open multiple folders or sections. However, with EHR, the data will be integrated within one another, and the systems can be updated easily by multiple people. So this approach would have a set vocabulary, so the providers share a common ground on terminology, and they can access information that they want on a patient. So another goal that we have for EHR is to have long-term documentation of health records. This means that it will exceed the shelf life of paper records and evolve with technology, while also complying with legal and ethical principles. So in my opinion, I think that overall this article is very well worded and informational. It has a high promise on practical uses of EHR, and I wholeheartedly agree on its potential and positive impact. I also liked how they talk about potential disadvantages, such as security, legality, ethics, and anything relating to storing patient data. However, I wish they brushed up more upon implementation. There will be a lot of thought needed in order to make this happen, because it will be accessed by multiple health entities, and doctors, hospitals, insurance companies, and patients will all have to be on the same page in order to make this whole thing work.
So when talking about EHR systems, it's important to understand that they are made of several different components in order to combine data from various sources. So these include administrative service components, which contain important information on patients, laboratory systems, which integrate lab data, radiology systems, which combine radiology, image, and data, pharmacy system components, which correspond with pharmacy automation, computerized physician order entry, which allow providers to order services online, and then lastly, documentation clinically, which support the system by penning notes or reports. So all of these reflect with what we talked about in lecture, in that EHRs are made out of smaller systems. So that's why it's important that these smaller systems work first before we get settled into the EHR system in its whole. When talking about problems in the EHR system, we need to figure out which system by breaking it down first in order to make sure that the EHR system in itself is successful for the healthcare and what it's trying to do for healthcare.
So, as stated in the article, one controversial topic around electronic health records is the user's privacy. So, I think that privacy is in general is a recent issue that has been popping up, with things like Facebook and social media and all this stuff. But to me, it's kind of interesting to see how it plays out in the medical field, especially with new technologies like electronic health records. Because as we know, electronic health records have many benefits, including like improved care and reduced cost. The only thing is that in order for electronic health records to be adopted, the issue of privacy would need to be addressed. And I think that the privacy issue here will be sort of different from that of Facebook, because within Facebook, people have the choice whether or not they want to give their privacy away. But within the medical setting, doesn't necessarily, people don't necessarily have the same choice, which in my opinion will kind of make it an obstacle to implementing it.